The ARTHRO-Syndesmosis lock system is designed to stabilize ankle syndesmotic injuries using a minimally invasive and reproducible surgical technique. It provides strong and reliable fixation while allowing physiological micromotion for optimal healing. The procedure begins with appropriate surgical exposure of the distal fibula and tibia through a lateral approach. The ankle joint is assessed and the syndesmosis is reduced to restore anatomical alignment. A drill guide is positioned across the distal fibula and tibia to establish the correct tunnel trajectory. A 1.5 mm guide wire is then passed through the fibula and across the syndesmosis into the tibia at a preferred angle under fluoroscopic guidance. Once the guide wire position is confirmed, the tunnel is created by drilling over the guide wire using a 3.5 mm cannulated drill. After tunnel preparation, the guide wire and drill are removed. The ARTHRO-Syndesmosis lock delivery handle. Preloaded with an oblong tibial button and a round fibula button connected with high-strength fiber wire. Is passed smoothly through the prepared fibula and tibial tunnels. As the implant exits the medial tibial cortex, the cortical button is deployed by controlled rotation of the metallic knob located at the proximal end of the delivery handle. Hold the black handle, push and pull the metallic knob under C-arm guidance until button deployment is confirmed. Then, unwind the fiber wire and release the round button. The delivery handle is then removed by releasing the sutures. Controlled tension is applied to the fiber wire while maintaining reduction of the syndesmosis. This gradually restores the anatomical relationship between the distal tibia and fibula. After confirming proper reduction and fixation under fluoroscopy, the sutures are secured and trimmed. Due to its dynamic stabilization properties, this system avoids the need for routine implant removal and facilitates earlier functional rehabilitation. ARTHRO-KI, a product range by ARTHRO-KI. Quality you can trust.